I don't know.
Hello, everybody. Welcome to the 99. I'm honored to be here. My name is Faz Shakir. I'm the campaign manager for Bernie 2020. Next to me is Bernie, running in 2020. I just want to talk very briefly for a moment for why do we do this. We are doing these live streams. We are talking to you directly, and one of the reasons is because while we appreciate our friends in the elites media, they don't often cover the issues that truly matter to working Americans. And so we are doing everything in our power to make sure we're telling the stories that matter, animating the issues that matter, and having a direct line to you so that you can ask us the questions that matter to you. So after Senator Sanders talks for a few moments, we're going to be taking your questions. Tomorrow, Senator Sanders will be delivering a speech on Medicare for All. And so that is the reason we're coming to you right now. We'd like to talk to you about Medicare for All. Senator Sanders, I understand this is something you've been dedicating your lifetime to. So why don't you take it away and tell the people.
Well, not my whole life. Not when I was 3 years old or when I was playing basketball, but much of my adult life. And as you indicated, Faz, tomorrow we are going to be giving a major speech on Medicare for All. And what I wanted to do this afternoon is just kind of preview a little bit of what I'll be talking about. And essentially, what I'll be doing is answering the questions that I think are on the minds of the American people. And I just jotted down some of them that we'll be discussing tomorrow. First question that I want everybody to be thinking about: is healthcare a human right? Or is it a commodity that, like many other commodities, one should have to pay for? Does that mean that if you are poor and working class and you don't have a whole lot of money, you simply will not get the health care you need, and certainly not the quality care that somebody who has a whole lot of money receives? So that's question number one. We've got to debate that as a nation. Somebody is rich, they can go out and get the best health care available in the world. Somebody is working class, well, you know what? They may not be able to afford to go to the doctor. Should healthcare be a human right? That's question number one. Question number two, related to number one. Why do we end up spending, and the media doesn't talk about this too often, why do we end up spending almost twice as much per person on healthcare as do the people of any other country? So, if you went out and you bought a fancy car, it's a big, beautiful car, and it cost you twice as much as a car that was not so fancy or good, you'd say, hey, I paid for what I got. We are spending twice as much per capita on healthcare as the people of any other nation. Are we getting value for what we're spending? How does that tally with the fact that we have 34 million Americans who have no health insurance at all, and even more who are underinsured, and we pay by far the highest prices in the world for prescription drugs. Does that sound like good value? Are you getting what we are paying for? Well, we'll be talking about that tomorrow, and I want all of you to be thinking about that. Why do we spend so much money on healthcare? Third question. How much do the insurance companies and the drug companies and the hospital industry and the medical equipment industry spend to protect their own interest? How much do they spend on campaign contributions and on lobbying? So in other words, people may think, well, you know what, we're having a debate about healthcare, and most people don't believe we should have healthcare for all. Most people are not worried about the deductibles and the co-payments, or that they can't afford to go to a doctor, or they leave the hospital and they go bankrupt. People aren't really worried about that. They like the current system. Well, maybe they do. I kind of think not. And tomorrow we'll be talking about the hundreds and hundreds of millions of dollars that the pharmaceutical industry, the insurance industry, the medical equipment suppliers, the hospitals spend to maintain the current system. In other words, in my view, and what we'll be talking about tomorrow, is the reality is that the issue is not a debate over healthcare. The issue is a debate over political power and the incredible wealth of the healthcare industry. But I'd like to hear what others have to say on that. One of the major concerns that folks have out there is that people cannot afford the very high price of prescription drugs. And in fact, and this is pretty crazy to my mind, 1 out of 5 Americans who receive a prescription from their doctors cannot afford to fill that prescription. I mean, how crazy is that? Does that have anything to do with the fact that last year the top 10 drug companies made $69 billion, that's a B, $69 billion in profits? What kind of system do we have when elderly people in Vermont are forced to cut their prescription drug pills in half while the drug companies make tens and tens of billions of dollars in profits? What do we do about that? How do we lower the cost of prescription drugs in this country? And lastly, I kind of want to throw out, just I would like people to be thinking about it, don't know if I'll put it in the speech tomorrow or not, is how come we don't discuss these issues on primetime television? My guess is that most of you who watch CBS or NBC or ABC or CNN or Fox, you've never seen a program that talks about the fact that in Canada, and I live 60 miles away from the Canadian border, that in Canada, if you have heart surgery, you leave the hospital without a bill. That you go to any doctor that you want, and it's not just Canada, that exists in Germany and France and the United Kingdom, all over Scandinavia, in fact, in almost every major country on earth. How much have you heard about that? Does that have anything to do with all of the ads that you see on television coming from the pharmaceutical industry and the power of the pharmaceutical industry and the insurance industry? So these are just a few of the questions that we'll be trying to answer tomorrow in our effort to, in fact, bring about in this country over a 4-year period what every other major country on earth does, and that is to make sure that every person in our country, whether you're rich, whether you're poor, whether you're middle class, working class, whatever you may be, that you go to the doctor when you need to go to the doctor, no deductibles, no co-payments, that you can afford the prescription drugs that your doctors are prescribing to you, and that if, God forbid, you end up or a family member ends up in the hospital, you don't have to go bankrupt because there is no bill, that healthcare is, in fact, a human right. So we need to have this discussion. I'll conclude simply by saying to Faz, and what he knows, and I think many of you know, is that when we fight for Medicare for all, we're not just taking on the Republican Party and Donald Trump. We're not just taking on elements of the Democratic Party. We're taking on one of the most powerful industries in the world, an industry, the healthcare industry, that has unlimited resources, and they will use those resources to protect their profits, which are very, very ample under the current system. So with that, Faz, I hope that people will be watching the speech tomorrow and be happy to answer any questions that people have.
Thank you, Senator. And as a reminder for everybody, I hope you do dial into the speech. It'll be at 4 p.m. Eastern Time tomorrow. We'll be live streaming it on right here on this channel. So check our Twitter, Facebook pages. We are soliciting questions online, Senator, and been taking some and looking at some of them as you've been speaking. The first one is from Melody, and Melody asks, "Can you please explain how Medicare for All will make prescription drug prices fair?"
Well, more than fair. What we believe is that prescription drugs, that the medicine that we need, is an integral part of healthcare. How can we be talking about healthcare if people can't afford the prescription drugs their doctors prescribe? There will be a cap on the amount of money that any person in this country has to spend for prescription drugs. So nobody in this country will be spending more than they can afford to spend. That's number one. Number two, even before we get to Medicare for All, right now, we are fighting to lower prescription drug costs in this country in half. On July 28th, I'll be leaving Detroit, Michigan, going over the bridge into Windsor, Ontario, and buying insulin. We'll have a busload of people with us who are purchasing insulin at a price, as I understand it, that is 1/10 the price being paid in America. Can you imagine that, folks? Same exact product in Canada, where they negotiate prices with the drug companies. They are paying 1/10 of the price for insulin in a nation which is dealing with a diabetes epidemic. That is a big deal. 1/10 of the price in Canada. So we are going to basically tell the pharmaceutical industry that they cannot continue to charge any price they want. There will be strong negotiations, and there will be a cap on what any person in this country can pay.
Thank you, Senator. Actually, while you were speaking, a Canadian named Hercules wrote in and said, "I had emergency brain surgery in Toronto, Canada, and paid $0 and had the best doctors."
I want people, read that again fast, because...
Yeah, his name is Hercules, and he said, "I had emergency brain surgery in Toronto, Canada, and paid $0 and had the best doctors."
All right. You see, that's not a discussion you're going to see on CBS, NBC, or the network news. But what he just said, can you imagine how much emergency brain surgery would cost in the United States? Who knows? I don't know. Tens of thousands of dollars, hundreds of thousands of dollars. Depends on how long you're in the hospital. I was in Toronto, actually, a couple of years ago, and I took along some doctors and nurses from the United States. And we went, they were very kind, in the hospital in Toronto. We went in, and they let us into, with the patient's acquiescence, they let us into the room to talk to patients. And this is what I remember. They said, "You know what, we're getting great care here, but there is something else that we have in Canada that you don't have in the United States. Look, I'm dealing with cancer. I'm dealing with heart surgery. I got a lot on my table. I got to figure out how I'm going to get well. This is a serious illness." In the United States, people not only have to deal with those illnesses, they have to worry about what's going to happen to the family's finances because of the hospitalization. You have heard it, I have heard stories where people who have been hurt in accidents, and they say, "Don't take me to the emergency room. I can't afford it." Well, we have thousands and thousands of people who leave the hospital and then they have to declare bankruptcy. Their finances are ruined. So what you just heard from this gentleman in Canada, major surgery, it doesn't cost you a penny out of your own pocket. Of course it costs money. It is publicly financed because it is a right in the same way that education is a right, that we send kids to elementary school. It is paid for out of tax dollars. Everybody contributes. In my view, it will be funded in a very progressive way, with the wealthy paying their fair share of taxes.
I remember we were on a flight to Iowa, and there was a woman at the end of the plane who had got a seizure and had to be taken off before we could all get off the plane. I remember having the sick feeling of hoping that she had insurance. I mean, that's a ridiculous way to think and operate in America. Anyway, so here's the next question from a person named Volo Moriarman. This individual asks, "Will there be any transition time period between the Affordable Care Act and Medicare for All, where people will lose any health care for a period of time, like some are suggesting out there.
Some. I think that some may be the former, we won't mention his name, but it might be a former vice president of the United States. Look, I think it's important that we have a healthcare debate on the facts and not on fear-mongering. Obviously, it goes without saying that nobody is going to lose their ability to go to a doctor or have surgery or have their cancer needs, their heart disease needs taken care of. That's just silly, and I don't think anyone takes those statements seriously. But, and this is an interesting point. How did it happen that way back in 1965, before we had the technology, anywhere near the kind of technology we have today, how did it happen that it took, I think, a year or so for, under President Lyndon Johnson, that we're able to establish Medicare in the first place? So think about it. They started with nothing. They came up with a very strong public health care program for people over 65 years of age. They didn't have the fancy computers and the technology that we have today. They were able to do that. And then people are telling me that in the year 2019, after Medicare has already been around for over 50 years, when we have all kinds of technology, that somehow we really can't do it over a 4-year period. So to answer the question, we're being pretty conservative here. I think it could be done quicker. But what we are saying is, first year what we'll do is cover all of the children. We will expand, and I hope senior citizens hear this, we are going to expand Medicare benefits for seniors to include dental care, hearing aids, and eyeglasses, which many seniors today cannot afford because Medicare does not cover those benefits, and we are going to provide those benefits. And in the first year, in addition to doing that, we're going to lower the eligibility age from 65, where it currently is, down to 55. And Faz, I cannot tell you how many people in their 50s or in their 60s that I have met. They're 62 years of age, they have serious health problems, they can't afford to deal with those problems. They are waiting, hoping they're going to live long enough to make it to 65 to get on Medicare. All right, we're going to lower that first year down to 55, then to 45, then to 35, then we cover the whole country. Medicare is a popular, well-established program. All that we are doing, despite all that the healthcare industry is going to expend trying to lie about what we're doing, what my opponents will talk about, all we're doing is expanding Medicare from people age 65 to every man, woman, and child in this country. Not so radical, really, after all.
I want to bracket a few of these questions because they're kind of in the same category that you were just talking about. One is from Jeff, who said, will it affect the benefits of people on Medicare already? And I'm going to bracket that question with a couple of others that say, are you adding any new benefits? And also, how would Medicare for All address paying for assisted living? So, there's a few things in Medicare for All in your package that changes Medicare.
All right. And let me preface my answer by saying you're going to hear a whole lot of misinformation coming out during the political season, led by the pharmaceutical industries and the insurance companies and the healthcare industry in general. They're going to be saying everything, how terrible Medicare for All will be. So let me repeat. The first answer is that we expand benefits. Medicare is a strong program. It is a popular program, but Medicare for seniors can be improved. I go around the country and you talk to people, dentures, pretty expensive proposition. Hearing aids, very expensive. If you go into the Veterans Administration, you can get good quality hearing aids virtually for free, especially if you're service connected, but that is not true for the general public. So we think that obviously hearing aids, the ability to hear, is a healthcare need. The ability to be able to chew your food and have decent teeth is a healthcare need. The ability to see is a healthcare need. We cover that under Medicare for All. In terms of home health care, I think this is a very serious problem in this country. You have a lot of seniors and people with disabilities who do not want to go, for all the right reasons, into a nursing home. They want to stay home. But the problem is that right now you have Medicaid doesn't fully cover that, and they are ended up being forced to go into a nursing home. And what we do through Medicare for All is pay for home health care. We pay for the people to come and cook you the meals you need, to change your beds, to wash you, and to take care of you. So those are added benefits that currently do not exist under Medicare.
We'll wrap it up here, Senator. And I thought this last comment from an individual who just wrote in was particularly poignant, and you can react to it and we can close it out on this comment. So this individual writes, my wife has multiple sclerosis and I pay 32% of my income on medical costs annually. She lost her job at the beginning of 2018 and is now legally disabled. Because of this, our credit is ruined and we have to sell our house. The current system is not sustainable for the people of this country. And this was an individual named John who wrote in.
Well, I want to thank John for sharing the situation with his wife and his family. And what I want to say to John is, John, this goes on all over the country. I have heard stories like this that break all of our hearts time and time and time again. People should not be forced to go into a financial disaster, going into bankruptcy, into having their credit ruined. Why? What happened? What did they do? Did they go to Las Vegas and gamble away all their money? A family member became seriously ill. And do we destroy families' credits, their financial abilities to live a decent life because somebody in their home is ill? And that is what the current system is doing. And let me just add to that. I mean, this is one story, and I'll tell you another story. Go out, and I say this to the folks who are watching this, go out and talk to your doctor and say, doctor, have you ever dealt with people who walked into your office too late and they ended up dying because they didn't get into your office when they should have, because they didn't have any health insurance, or they had high co-payments and deductibles and just didn't feel that they could come into the office? And I suspect those doctors will tell you what they tell me, is that they lose patients time and time and time again from illnesses that were preventable if people walked into the office when they should have. And in fact, the estimates are that we lose 30,000 people a year who go to the doctor when it's too late. I don't know, Faz, if you saw it. There was a piece in the Washington Post a few months ago talking about a group of volunteer doctors who go into rural Tennessee, I think it was. And the pictures make you think you're living not in a third world country, but a fourth world country. These are people who are sleeping out on fields because they can't afford to see a doctor or a dentist. This is in the United States of America, not just Tennessee, but in fact all over this country. So I thank John for sharing his story with us. And that is the kind of situation that we intend to end with Medicare for All.
Thank you, Senator, for making time. We'll continue to do these. I hope you'll tune in tomorrow at 4 o'clock when we talk about Medicare for All in more detail. There's so many other pieces of this that we didn't touch on, so the impact on small business owners, the administrative relief, and the simplicity of Medicare for All. We'll have some more time. Senator will have some more time to discuss it directly with people tomorrow, 4 p.m. Eastern. Hope you'll dial in. Thank you for being with us. Thank you for supporting this campaign.